Good evening, Mr. Chahal. Thank you so much for being
For sure.
here. And uh, good evening to you. Good evening to Dr. Chaurasia, Dr. Bhansali, Dr. Bhandari here. It's really nice of you for sparing your time, Mr. Chahal. We know that you have made a monumental and fundamental change to the city of Mumbai. Mumbai is not any ordinary city. It's a very, very complex city with very complex demography, complex pain points, and very different dynamics. It's of course a capital of the financial capital of India, but more so, I think it stands out as one of the top three or top five cities across the globe where the demands are very different. The way you resolve the challenges for Mumbai are defining here, and they are defining the Mumbai in the sense there are several lessons which we have to learn from here, and we want to hear to what how you identified the pain points, constraints, the compulsions there, and how you refined a model, and then how you executed it. So before I get started there, I have to really appreciate the time you have spared to help the global community understand what exactly has been done here in Mumbai. We are so glad to have you here. Welcome, sir.
Thank you.
Gautam ji, namaste.
Uh-huh. Hello, Dr. Gautam Bhansali. Thank you so much for joining.
Thank you, sir.
Uh-huh. Let me explain what CovidRxExchange is, and then I'm going to turn it over to Dr. Chaurasia, who will explain what he's one of the key drivers from India as well as for CovidRxExchange. So way back in April 2020, we realized that so much new is happening in COVID that this knowledge has to be disseminated or spread across across the borders, across the globe in real time. Disseminating knowledge in real time was one of the key objectives, and it came on multiple stacks, whether it be how to manage the communities in a pandemic, how to manage hospitals in a pandemic, or whether to treat patients. And of course, at that point of time, we were in an acute or hyperacute phase. Eventually, we went into a lingering phase, and now we see a second surge. But the intent was to basically create a portal where doctors could come, interact, and understand and learn how best to take care of their patients. This portal is for exchanging knowledge, expertise, and insight. This portal is not for recommending or treating patients. So, we have been kind of involved in that part of it. This portal sits on top of whatever has been done already. So we call it as a more aggregator portal rather than basically a research portal. So that's a key difference which I want to highlight here. Some of the fundamental things which underline or underpin our initiative are the Hippocratic Oath, the values of the Hippocratic Oath. We are completely non-commercial. We are non-profit organization, and we don't even take advertisements or donations. So we are not in any way touched by money here. And the third important thing is we stay away from conflict of interest and any political leaning or discussions here. So having said that, I want to also introduce you to our esteemed team here, which consists of, give me one moment, bear with me. Our governance team is comprised.
Please share the screen. Shashank,
Yes,
please share the screen.
I will. Bear with me. I will share the screen. Give me one moment, okay? So sorry for the interruption. Bear with me.
It's okay.
Okay, so we have a esteemed governance, like the most senior, most industry leaders whether they be from medicine, whether they be from technology, or whether they be from the non-technical background, they are part of this initiative. And we are expanding our team vigorously. Some of the key members who have been the founding members are Dr. Ajay Chaurasia, Dr. Hemant Bhandari, who's on the panel here. We have Dr. Anand Kaude, who is a vaccine expert for Government of India. He's the leading vaccine expert for Government of India. Dr. Maheshwari, Dr. Ashok Anand, who is professor and head of the Department of Gynecology. Dr. at Grand Medical College, Dr. Lakshmi Sambal Kumar, who is an infectious disease expert here in Dallas, and Dr. Nandita Dibekar, who is a critical care and anesthesia expert based in the UK. So that's basically the governance team. In addition to that, we have an editorial team of almost 26 people. And in addition to that, we have a whole lot of technocrats. That is how typically I'd like to call them. Like, they have been devising the solution. So, that's basically in short about our team here. But, I want to turn over this to Dr. Ajay Chaurasia. Before that, let me introduce Dr. Ajay Chaurasia. He's one of the key drivers for CovidRxExchange. He is a professor and head of the Department of Cardiology at Topiwala National Medical College and BYL Nair Charitable Hospital in Mumbai. He has done phenomenal work. He has been instrumental in devising and bringing CovidRxExchange to the level where it is. So over to you, Dr. Chaurasia.
Good evening, all. Namaste to all. On behalf of CovidRxExchange, I am privileged to welcome our esteemed guests, namely Mr. I.S. Chahal, the Honorable Municipal Commissioner of Mumbai City, affiliated to Municipal Corporation of Greater Mumbai, Dr. Ramesh Bharmal, Director of Medical Education and Health, Municipal Corporation of Greater Mumbai, and Dr. Gautam Bansali, who is a consultant physician at Bombay Hospital Institute of Medical Sciences, Mumbai. While Dr. Ramesh Bharmal and Dr. Gautam Bansali assisted the Honorable Municipal Commissioner in developing and strengthening the public and the government, public and the private hospital medical corona care. Mr. I.S. Chahal, a man who was thoroughly sleep deprived, he has relentlessly been at the forefront in the fight against COVID-19 pandemic at Mumbai. Just to apprise the global participants that Mr. I.S. Chahal, an All India Science Merit rank holder with BTech honors, is no-nonsense Indian Administrative Officer, Service Officer, what we call in India as an IAS. Mr. I.S. Chahal has been an officer on special duty to Home Minister of India in 2013 and 14. As an urban development, he has been the principal and joint secretary in the Department of Urban Development, Water Resources, Panchayat Raj, Women and Child Development, Food and Drug Administration, Excise, Home Affairs, Mahala, the significant Dharavi redevelopment project and environment. He has been collector at Thane and Aurangabad. He has been an additional divisional commissioner at Aurangabad division. As an urban development secretary, he was made in charge of corona tracking, Maharashtra state, contact tracing for rest of Maharashtra, COVID-19 containment zone management and monitoring. On an earlier occasion, he conceptualized, planned, and launched Dharavi redevelopment project. Who best would have been other than Honorable I.S. Chahal as the Municipal Commissioner of Mumbai to fight head-on against Corona, having known lanes and bylanes of Dharavi, the largest slum in Asia, probably the world, along with his 15 years of bold, courageous, consistent, continuous, uninterrupted on-field experience, besides his abundant experience in rural development, poverty alleviation, social justice and empowerment. As an athlete and a marathoner, Mr. I.S. Chahal descended right on the ground, absolutely on field from day one when he took the reins of Municipal Commissioner of Mumbai amidst the frightening week of COVID-19 infection and visited the corona-affected critical poor patients wearing a PPE, mask and face shield. Till now, nobody has gone to the patient's bed. He reached out to the patients, both in the intensive care units and wards, dogmatically and emphatically assuring them to overcome their pains and suffering of Mumbai at large due to the dreadful COVID-19 pandemic. Mr. I.S. Chahal will speak on his multiple modules, which he designed and implemented successfully to halt COVID-19 crisis in Mumbai. He will apprise the world about the challenges he had to face to instill life into the bustling city of Mumbai, which was caught with an awe, severe apprehension, possible uncertainties surrounding the COVID-19 infection and its dreaded outcome. Mr. I.S. Chahal could succeed with his on-field grounded strategies, medical and non-medical, to combat and overcome the catastrophe. COVID-19 itself being deceptive will keep posing new challenges. But Mr. I.S. Chahal has prepared the Mumbai city for facing any eventuality most effectively. Over to you, sir, Mr. I.S. Chahal, the Honorable Municipal Commissioner of Mumbai, for a global sharing of Mumbai anti-COVID-19 model. Mr. Chahal, please take the dais.
Thank you very much. Good evening, Dr. Chaurasia, Dr. Shashank Hide, and Dr. Gautam Bansali. First of all, I would like to thank you from my heart for having given me this opportunity today to present the Mumbai model of containing and controlling COVID-19. I am really thankful to you. Before I unfold and share with you the Mumbai model, let me give you some statistical facts today. Although my friends would be reading in the media that as in today morning, Mumbai had 1,48,000 cumulative figure of COVID positive people. But I must tell you that as in today, more than 1,21,000 people have been discharged, treated successfully, and they are back to the normal life. And for the remaining people, we have just around 6,500 people who are actually in the hospitals today, which means out of 1,48,000 so-called big figure of COVID positive in Mumbai, we just have around 6,500 people on the hospital beds, remaining about 14,000 are home quarantine. And when you see in a city, a mega city of 20 million population, occupancy of 5,000 beds, and the way we prepared for COVID-19 in the last 4 months, today we have reached a figure of 100,000 beds in Mumbai. Out of 100,000 beds, we have exactly 22,300 COVID beds in hospitals only, which means they are DCHC or DCH, where you have oxygen facilities, you have ICUs, you have ventilators. And besides that, we have roughly 24,000 beds which are available in our COVID care center for asymptomatic positive patients who come from slums, who don't have a proper house with an independent toilet, and we quarantine them. We put them in triple C2, which we call as COVID care center for asymptomatic positive. And besides that, we have created nearly 48,000 quarantine beds for those high-risk contacts to segregate them and to separate them from their infected surroundings, especially in Mumbai, where 62% people live in slums, and more than 11 million people are in slums in Mumbai today. So from that angle, we have roughly 48,000 beds there. All this put together comes to 100,000 figure. And this kind of preparation, I would humbly submit that this is one of the best prepared cities in the world today to face any onslaught of another wave, which experts always advise me. They comment on this, and I always say that we are prepared for the worst and we are hoping for the best. Now, with this background, we have a doubling rate of almost 77 today. We have our rate of infection, which we call as R, is 0.9, much below 1.0. And we have done about 800,000 testing till today morning. And in this also, I must say that out of 8 lakh testing, almost 7 lakh testing are the gold standard RT-PCR only. We haven't relied much on the antigen testing because that gives you a false satisfaction of 4%, 3% infectivity. We have done about 100,000 antigen testing, but our benchmark, our motive, our objective, our decision has been to not compromise with RT-PCR tests. And another statistic we like to give you is that starting from May to June, June to July, July to August, August to September, if you see things unfolding on a monthly basis, we used to have around, we had 40,000 cases from May to June. We had 37,000 cases from June to July. We had 36,000 cases from July, August. And now this month, we had 30,000 cases from August to September, which means in the last 1 month and last 31 days, we are getting about 1,000 cases a day. And we have 24 wards in Mumbai, which means roughly we're getting about 40 cases per ward, and each ward is roughly 7, 8, 9 lakh population. So with this background, how did we do it, and how could we control this? Because everything was on fire in April and May. And when I took over on the 8th of May as the Municipal Commissioner of this great city of Mumbai, I was fortunate enough that when the first case of COVID came in Maharashtra on 16th of March, the government of Maharashtra had appointed me as a nodal officer for monitoring of COVID-19 across the state in 36 districts and 27 municipal corporations of the state. You know, Maharashtra is the most urbanized state in the country, where we have almost 50% people of population in urban areas. And this COVID had hit first the urban areas. So from 21st March, the day we declared our first lockdown before the 22nd March Janta curfew, which was announced by the government of India. From that day till about 8th of May, I was daily collecting various figures and statistics from my colleagues in the municipal corporations and the collectors of various states. How many cases have been identified? What is the testing done? How much has been quarantined? People have been quarantined. How much tracing and tracking had happened? What is happening with the testing lab? We were building upon that. And I'm happy to say that, like, we took a very positive decision. Honorable CM Maharashtra said that this lockdown is just not meant for putting people indoors and just not getting rid of people from the roads. The primary objective of the lockdown has to be to strengthen, upgrade our health infrastructure. This is a time we are borrowing, in which that by the time this lockdown is relaxed, we should have upgraded our health infrastructure. And that is precisely which the state of Maharashtra has done. So when I joined as Municipal Commissioner on the 8th of May, I had the role cut out for me, because those days things were quite difficult, and a lot of cases were coming, and a lot of social media videos were roaming around. 2 people, 3 people lying on one bed, people lying on floor, somebody having died in auto rickshaw, somebody died on road divider, somebody's dead body was found in Dadar on some street. So it was very, very sorry state of affairs, because we knew that, like, unless we pull our socks, this can blow and go out of control. And you see a slum like Dharavi, where you can just forget about social distancing. You have 800,000 people living in 2.4 square kilometers, which means you have 234,000 people per square kilometer. So what kind of social distancing you can observe in those areas? So we needed to have out of the box solution for all this. So the day I joined, it was evening 7 p.m. It was straight to the 5-hour meeting with my team. And I must say that my entire team, starting from my 4 additional commissioners, Ashwini Bide, Sanjeev Jaiswal, Mr. Suresh Kakani, Mr. Vela Rasu, Mr. Ashutosh Salil, Joint Commissioner, all my deputy commissioners, assistant commissioners, ward officers. It has been an outstanding team. And I would give full credit to the team that the way they rose to the occasion, they rose like a phoenix. And on the first day, we took a decision. We said no Zoom meeting, no VC. We must get all this our 100+ people in one hall. Forget about what is going to happen in COVID. Those days, people were hardly not even willing to meet face to face. But we spent 5 hours, 120 of us in one single hall. And because I always say that the best meetings happen when there's eyeball to eyeball contact with your colleague, and you squeeze out commitments from them. Otherwise, like, things are not that, according to this is my personal opinion, when you meet on a Zoom or a VC, vis-a-vis when you meet physical, because body languages matter a lot. And that day, all of us, we resolved for one common mantra, that either we perform or we perish. And that will apply equally to the municipal commissioner and anybody else. And then secondly, we decided that this was the first pandemic where the frontline workers are at risk. Unlike cyclones, unlike tsunamis, unlike earthquakes, where the frontline workers arrive after the epidemic, the calamity has gone, and they are safe, I would say, in many ways. But this was the first calamity where the frontline worker was at major risk of losing his life. And but we said we have no option. So right in the very next day, we started visiting the slums, my entire team, including me. And I'm happy to share that till today, I have visited about 55 slums of Mumbai, and I have visited most of the ICUs of COVID of our hospital like Nair or Sion. But God has been kind to all of us. And from there, the entire spirit changed. And we found that our people started getting into containment zones. They started getting into slums, because 3 days before I had joined, the Government of India team had visited Mumbai. And they had, in the wrap-up meeting where I was also present, they had, I would say, they had highlighted or they had raised this issue that the BMC officials and health workers are not entering the containment zone, and they are not entering the slums, and this is the main problem is happening in Mumbai, and why so many issues have been raised. So we decided that now that is the last time anybody will make a statement like that. And from that day till today, I'm happy that the statement hasn't been repeated at any platform. Because the moment we started getting into slums, we had our 30,000, 40,000 people entering slums every day. And it's happening today also. And the fear went away. The fear had gone away. So after that, we changed the strategy, and I told my team that we have to be offensive. Now, how do we get offensive? The best thing is to chase the virus. We started this strategy, or we coined this this thing of chase the virus. And chase the virus is just not entering the slums, or not just entering the containment zone. So under chase the virus, we said that not only our thousands of health workers and our other officials will start visiting home to home for home surveillance by actual field visits and visiting their residences. But we take out comorbid people, we take out suspected people, we test them, we put them in government quarantine, and we made it a rule. We said that for every positive person coming out in a slum area and containment zone, there shall be 15 institutional quarantine, which means his entire family, his neighbors, or people who have come in touch with him, they'll all be put up in common quarantine for two reasons. One, we have to break their contact with the virus in the virus infected area, and we'll put them in good. We had created quarantine beds in good 2-star, 3-star, 4-star hotels. We had taken over 167 hotels of Mumbai and made them as quarantine centers. People were too happy to go there for 10 days. They would be observed there. If they didn't have any symptom after 10 days, they would discharge, and they developed the symptoms, we'll test them and put them in hospitals and treat them. In the meantime, we would also ensure that their surroundings, their residences, their homes are sanitized, locked, and made virus free. This was one of the best ways we found to contain the virus and to disconnect the virus from the large number of people. In a few weeks, we had more than 150,000 people moving out from their homes into these government quarantine. And this helped in a big way because majority of this 150,000 people didn't become positive because they were taken out from the slums and put in a more conducive and positive and a healthy ambience. So while doing Chase the Virus, we knew that I always say that there are 4 main pillars on which the foundation of or the ceiling of COVID fight is rested upon. And I knew that this COVID fight is not a short term or it's not going to be for 1 or 2 months. It's a long fight. Today also we do not know how long this fight is going to go on. It's like winning a battle a day and fighting a war which we are doing with the invisible enemy, and we do not know how many days, how many months is going to last even from now also. So the 4 main pillars or platforms which need to be strengthened and put on autopilot, because these things, unless you put on autopilot, you can't firefight them on phone calls and meetings every day. So first was the testing regime or the testing lab. The second was the ambulances to ferry the patients. The third was hospitals and the hospital beds and the hospital management. And the last was, and the most important, was the doctors and the medical and paramedical staff. So unless these 4 pillars get strengthened, I knew that it will be impossible to fight this war, which may last for several months, maybe more than a year or maybe more. You never know. And secondly, for fighting this battle a day and ultimately this war, it was very clear to me that I didn't have anything but not more than 5 tools with me or 4 instruments with me. The first was the lab reports. The second was tracing, tracking, quarantining, and then treatment. So these 4 pillars and 5 techniques, we decided to put everything on autopilot. So the day to day, this battle may go on for months together, but we should be all out of it and things should happen automatically. Now, when I joined, we had 23 labs in Mumbai, testing labs, and there are a lot of issues of test reports coming not on time. I always mention that 4th April reports were coming on 22nd April. It would take 15 days, 17 days, 18 days for a lab report to be received. And it is on record that many people who had given the swab, they had passed away, and even the high-risk contacts also died by the time the reports came. So I said, this cannot be tolerated, and this cannot happen in future now. So we had a number of Zoom meetings with CEOs of these labs, and ultimately, in a few days, we got these labs in autopilot. We decided that all these labs they can take as many samples as they desire, and they should decide their own capacities. But the calendar day would be their target from 12 midnight to 12 midnight. Whatever number of swabs they can collect for RT-PCR, they can test and produce reports at midnight in a line list. All these labs online should send these reports only to BMC first, and later on to be shared with the patient. Because there was a lot of chaos. Those days we were getting about 1,500, 1,700, 1,800 cases a day. And whenever a crude SMS would go to a patient that you are turned positive in the evening, he would panic. He would start calling his friends, doctors, IAS officers, politicians, honorable ministers, and they'll generate thousands of phone calls, and our control room lines would collapse. The control room would collapse, and there'll be chaos, and the media would take over. That beds have exhausted in Mumbai. We said that, like, to avoid the confusion, let the reports come midnight to BMC in a line list, and our team, right from May till today morning, they sit from midnight, 12 o'clock to 6 in the morning. They clean up this list, whether they're duplicates, whether there are any RT-PCR tests of people who are already admitted, already occupying beds, have to be discharged. After cleaning the list, by 7 o'clock, these clean list is split automatically online into 24 parts for 24 wards of Mumbai. And there we started a decentralized online bed management. And our phone calls start going to the patient's residences. And very soon we reach their residences with beds and choice of beds, which hospital they want. And until our ambulances, they ferry them from their residences to the hospital bed, the task is not accomplished. We started saying that there's a chase the patient, right from chasing his lab report till he's put in the hospital bed of his choice. We are restless, the BMC, the team. And each of these ward rooms which we created by abolishing or scrapping the central control room and the central helpline, it was equipped with 10 ambulances each, 10 medical teams each. It had doctors, it had telephone operators, it had teachers to help the doctors. And each and every patient gets a phone call at 8 in the morning about his report status, and we inquire about his health. If he's asymptomatic positive, we ask him whether he would like to be home quarantined or he would like to go to hospital. If he is symptomatic, our medical teams rush in ambulances to the residences with pulse oximeters, temperature guns, and the primary or preliminary investigation happens at the residence. And then the decision is taken what kind of bed he should be allotted, whether it's COVID bed or an oxygen bed or ICU bed or a ventilator bed. And even if we have a list of 1,500 coming to us every day, the moment is split into 24 parts, each ward room just gets about 60 names. And there are 10 dashboards, each dashboard gets about 6 names only. And out of which if 4 or 5 are asymptomatic, there's hardly one person to be handled by one dashboard for bed allotment. And we start at 8 o'clock, and by noon or 1 p.m., 2 p.m., this entire list is disposed of. Now this thing has gone on autopilot, that in the last 1 month, I have never got a unknown WhatsApp or unknown what message that somebody is not getting a bed and somebody is not able to find a COVID bed in the hospital. Questions like bed not available, questions like patient roaming in 2, 3, 4 hospitals and ultimately bed not available anywhere, they had become irrelevant. Because till 8 in the morning, the patient doesn't know what his status is. He cannot step out. And by 8:20, 8:25, our ambulances reach his residence if he needs a bed. So there's no reaction time for him to ring up the control line or to leave his house to seek a bed. And here I must say that perhaps Mumbai was the first city in the world where private hospitals and doctors like Dr. Bansali and CEOs of all these private hospitals, they came as a blessing to me. And I salute them for this. We were the first city in the world which on 24th of May, we signed an agreement with them totally with mutual consent. and they handed over 100% of the ICU to BMC for allotment. They handed over 80% of their COVID beds and 80% of the non-COVID beds to us for allotment and to be allotted at government rate. Just imagine a person getting a bed for 4,000 rupees per day in Breach Candy or Leelavati or Nanavati, which would have cost him maybe 4 lakh rupees a day. So this was human service done by the doctors of Mumbai in helping us. And that suddenly our bed availability, within few days of my joining, it doubled. We got almost 3,000 COVID beds. We got 417 ICU ready-made and one of the best ICU in the world to handle with full allotment powers. And the hospitals would tell the patient that if anybody needs a bed, they should contact the BMC local ward room. And every ward room had access to any bed in Mumbai, and he could allot any bed in Mumbai. So this particular model, which is under implementation today also, where you get a 4,000 COVID bed per day, you get an oxygen bed for 7,000 rupees a day, you get a ventilator bed for 9,000 rupees a day, in one of the best hospitals in India, if not one of the best in the world, at such cheap rates. This came as a blessing to the citizens of Mumbai. And there is where I would like to thank all the doctors, the managements of these private hospitals, and the CEOs of the hospitals, who are not like doctors today, they're more my friends today. And I'm happy to say that one of the high courts of neighboring high courts of India, after a few days, mentioned that if Mumbai city could achieve this with private doctors gelling with BMC and government and a single dashboard operating, BMC lotting all the beds. In fact, later on, private hospitals started telling me that you lot our 100% beds only. And the allotment of beds would happen in few minutes and sometime in few seconds also. One day, a friend of mine called from Delhi. I told him that in 60 seconds, the bed will be allotted in Breach Candy, and it happened in 60 seconds. This was the kind of efficiency which came in allotment of beds and availability of beds. And this system continues today also. And I was mentioning about the High Court. The High Court mentioned that if Mumbai could achieve this, why not other cities of India? Mumbai became a role model. The private hospitals of Mumbai became a role model. And suddenly, instead of 13 peripheral hospitals, the 4 main BMC hospitals, KM, Nair, Science, Seven Hills, and 2 government hospitals, GT and St. George's, which all add up to 18, suddenly the BMC dashboard had 147 hospitals on the dashboard. And out of leaving this 18 of BMC and 2 of government, the remaining were all private. And just imagine, single window allocation of 147 hospital beds. And with jumbos chipping in after that, we were the first city in the country to start jumbo facilities. And today, we have 9,200 beds available in 8 jumbo facilities in BKC, in Nesco, in Daisar Naka, in Mulund Naka, in Richardson Gurdas, Race Course, and NSC Dome. So these facilities became, added another 9,000 plus beds to us. And ultimately, our dashboard went to 16,000 COVID beds with another 7,000 waiting in the queue. They could have picked up on the dashboard any time. And I would say this was unique in the country. When today also, I don't think there's any city in India which has 9,200, and out of which there are 70% beds are oxygenated and 612 beds are ICU beds. They are not quarantine beds where people are put as a COVID care centers. They're actually actual hospitals with ICUs, with dialysis centers, with specialist doctors working around the clock. So all this model led us to a very comfortable situation. Like I mentioned that today we have just about 6,500 hospital bed occupied, and we have a inventory of 23,000. So this is one example to show or to prove how well prepared we are for the worst, wishing for the best and being prepared for the worst. I mentioned earlier. Now the labs were so streamlined that I am grateful to all the CEOs of the labs also. You see, for the last almost 100 days now, Mumbai may be the only one city where each and every RT-PCR report comes within 24 hours dot. And there is in Mumbai from 3rd of July, we have scrapped prescriptions. Any citizen can ring up any lab and ask for home testing. 100% home testing is allowed. So we have one of the most liberal regimes of testing where each citizen is getting a report within 24 hours dot. I get a turnaround time of these labs, and I'm happy to say that all the labs are producing results and conveying to BMC in a line less than 24 hours. I have my cousins and friends in America where I am told it is taking 7, 8, 10 days today also to get RT-PCR reports. Even it's happening in India also in our neighboring districts, neighboring states. But here I can put it on record. There is no report coming after 24 hours. So the labs went on autopilot. The decentralized ward rooms equipped with 10 doctors each and each of these 24 wards, young MBBS boys and girls managing these ward rooms. So they went on autopilot. The hospital was augmented thanks to jumbo hospitals coming in. And you know, another thing which happened was we didn't have to scramble and run around to convert our non-COVID beds into COVID beds, because our private hospitals were so generous and they were so cooperative. Honorable CM sir had appealed to them that now the time for public service, now the time to serve humanity, and now the time to forget about profits and things like that. And I'm so happy that they all joined hands and they have been observing that motto to help the mankind from that day, from 25th of May. So because of this, we got so many ready-made COVID hospitals on board. I'm happy to say that since I joined 8th of May, I did not have to convert even a single non-COVID bed in any of my hospitals into COVID bed, which means that the COVID treatment continued in a substantial way in Mumbai. There was no attack or there was no hampering of COVID treatment. Some people coming with for angioplasty or some renal failure, or some people coming from bypass surgeries, they also continued, maybe not a normal way, but in a good way. So these things also went autopilot. Next was the issue of doctors. So we announced a number of schemes in which we said that Honorable CM sir, he took several Facebook addresses and appealed to the retired doctors of Army, Navy, Air Force, state government, central government, and appealed to them. And I'm happy that 3,750 of these paramedical staff and doctors, they came forward and they joined us in a big way. And now they're serving for us. Similarly, we announced that Maharashtra has one of the largest number of medical colleges in the state. We have more than 60 medical colleges now. And I knew that each of these medical colleges has about 200 students who are in the final year of MBBS and they're doing internship. So we have more than 10,000 of students sitting home doing nothing in the lockdown. We invited them that if you work locally in your district, wherever you are in Maharashtra, in the rural areas or in the district headquarters, if you're working for COVID work or non-COVID work, your internship is 11,000 rupees. We will give you 50,000 rupees if you come and join us. We'll give you a free stay in a 4- or 5-star hotel till your entire stay is there, boarding and lodging. And plus you join us and help us in this ward room, help us in other activities. And we had almost 800 doctors suddenly jumping the bandwagon and joining us. And we got doctors in Kerala, 100 doctors and nurses. So doctors came as COVID Yodhas on voluntary basis. They came from rural Maharashtra and interns in hundreds. They came Kerala. And plus we also announced that anybody willing to join us, we said 80,000 rupees for MBBS doctor, 200,000 rupees per month for a specialist doctor. No question asked, come and join and start working. And now of late, we went for outsourcing. And we had 612 beds in our jumbos. So we raised an expression of interest and a group of doctors joined hands. They participated and they taken over this outsourcing service. And now these ICUs are being run by these outsourced agencies. So all these were very, very bold and unique initiatives, which we could say that we have been pioneers and they have been working very successfully. Right now, when I'm talking to you, our Bandra Kurla complex, BKC Jumbo, has 108 ICU capacity of beds with ventilators, and more than 60 beds are now occupied of COVID positive patients who are in ICUs. And all this ICU is being managed by an outsourced agency, which are a group of specialist doctors who come forward, and we are just paying them 6,000 rupees per bed per day. And medicines and other facilities we're providing them. And they are bringing the entire staff, right from ward boy to nurse, to doctors, to specialists, to interventionists. Everything is being catered by the agency who has come forward. So this is also a very unique model. We started outsourcing oxygen beds, outsourcing ICU beds, and it's a great example of public-private partnership. And even these things are now getting on autopilot. Now, next, coming to the issue ambulances. When I had joined, we had 80 ambulances in BMC, and today we have 826 ambulances. Ambulances have gone up by 900%. And we simply told the Transport Department of Maharashtra that to get us these hundreds of Tata Sumos and Innova vehicles, SUVs, which we converted in our workshop into ambulances, and they were deployed. Now we have 240 ambulances parked 24/7 in our 24 ward war room. We have dozens of ambulances parked in our hospitals. We have dozens of ambulances parked in our COVID care centers. In fact, now my staff is coming to me, sir, should we get rid of 100, 200 ambulances, because our ambulances are far more than the patient's requirement. But we are still hanging on to this large number of ambulances. We borrowed the Uber platform from Uber company, only the software, nothing else. We didn't take the vehicles or drivers, we just took their software platform. And we put these ambulances on software platform of Uber, and they are functioning as good as an Uber vehicle would function anywhere in the world. And again, we were the first city in the world to have this Uber-based ambulance movement. And all these ambulances are absolutely free of cost to the patient, and the patient can get them in few minutes as and when he requires. Another unique model we started in Mumbai was that in India, as you all know, we couldn't have matched the number of tests which happen in Europe and America per day, because initially we had only 2 labs. Today we have 23 labs in Mumbai. Today our testing capacity has gone up to about 15,000 if you put antigen together, and our RT-PCR capacity is about 9,000, 10,000. But initially in the month of May, June, we had large number of patients, especially symptomatic patients, and everybody couldn't be tested because of this limitation of testing. Many of these patients would start dying because suddenly they'll become breathless in slum areas. They will come gasping for breath. They will die on way to hospital, or they would die at their home, or they would die in hospitals because they came late. So since we had abundant beds, we started a new practice, and it's also on autopilot now, of 2,000 beds reserved for walk-in patients only in our 8 jumbo facilities. Which means if anybody doesn't have a test report, any citizen of Mumbai, he's not feeling easy, he's feeling uneasy, he can call ambulances, or he should take a taxi and straight away drive into one of the jumbo facilities. Like if you're somebody who knows the geography of Mumbai, for the northern slums, we have NESCO, and for the central slums, we have central Mumbai, we have BKC. For the southern Mumbai, we have Dome. For the eastern suburbs, we have race course, where 2,000 beds were made, fully oxygenated beds were made, walk-in beds. No test report required, no testing required, no result required, no question asked. You simply walk in there, and the dean there is waiting for you. He'll immediately put you on a suspected bed. He'll put you on oxygen or on a ventilator, whatever the requirement is. You will be tested, and in due course of time, if you are positive, you move on to the COVID section, and if you are negative, you will be stabilized, made good, and then discharged. So we started the unique practice of today also when I'm talking to you, we have about 900 people who are suspected, who have walked in like this. And most of them would have died if we had not created this facility. So the last about 100 days now, this facility is working in autopilot, and we went for aggressive publicity through our respected elected representatives, our respected MLAs, respected MPs, and we gave advertisements in print media, electronic media, so people are aware that these facilities are available of suspected beds for them. So they need not worry if they don't have a test report and if they're unwell. So this also covered up our limited testing. And because of this arrangement, it is very difficult for somebody to say that somebody died because he was not tested, because he has every right now to walk in and occupy a bed, which otherwise he would have occupied an oxygen bed or ICU bed with test report. So this also we have now, this facility is also on autopilot. The deans working day and night. They are doing great service and they're working so hard. I'm so proud of them. Next issue was now the various techniques of fighting this battle a day and ultimately the war on COVID. Testing I've just explained to you. Then the most important thing is now tracing and tracking. So we decided that in slums of Mumbai, where a lot of cases were coming initially in the month of May, June, July, for every case, 15 people have to be institutionally quarantined. Later on, we made it 1:20 ratio in northern slums and eastern slums where cases were coming up. And because of this, I'm happy to share with you that from 1st of July onward till today, in the last about 60 days, the contribution of slums to COVID positive is only 20%. 80% cases are coming from non-slums now. You see, and this is consistent. This is happening entire July, entire August, where the share of slums in COVID positive line list every morning is never more than 20%. Sometimes it's 15%, 16% also, which means that 80% cases are now coming from isolated high-rise buildings of the middle and the rich class. And because of that, now our in case of virus, the number of institution quarantines are reduced. Because people in a fluent community, they have independent toilets, they have independent bedroom, they can be quarantined properly, unlike people in slums where density of population is very high. And before I move on, I must mention, I put a minute or two on our Dharavi model. You know, when Dharavi were exploding, and experts were telling us, the media was telling us that this is going to now gulf entire Mumbai, and like you would see on TV, television, things happening in Italy and other European cities, people dying on footpaths, there are tents on the footpath, people dying on the roads, and people with ventilators on the roadside. So I was very worried and I was very afraid that we are not very far away from that day. So, and Dharavi is only one slum. We have hundreds of slums. Like I would say that Dharavi became famous because of his very reasons, but we have a lot of slums in M East is Chembur, where Govandi, Banganwadi, Devnar, these slums are even more challenging than Dharavi. M East is one of the 24 wards, which is population of 10 lakhs and 8.7 lakhs are slum dwellers only. 87% people in slums. And today, their infection rate is lower than Dharavi. They have done better than Dharavi. So we decided that let us not wait for the vaccine. Let us not wait for the medication. We must catch people in our surveillance only. And in that strategy, we got into the slums. We got into the slum houses, our medical teams, our health workers. We started picking up COVID morbid people. We created community leaders in each of the slums, each of containment zone. And only a person living in the family for years together in this containment zones could be eligible to be a containment zone leader. He couldn't be a nice outsider. And we started sanitizing the washrooms of Dharavi and other slums 6 times in a day because 200 people were sharing one toilet. We started checking through community leaders the quality of food going there, general sanitation there. we started distributing free PPE kits to thousands of doctors, to small clinics in these slums like Dharavi, that you open your clinic, we'll keep on giving you free PPE kits for you, your assistant, your compounder, or your helper, but you kindly, for God's sake, open your clinics and help the people. The community leader will inform us that whether these are operating or not after they're getting our free PPE kits 1 week's quota in advance. So we gave various functions. If some health worker has missed out on some comorbid person in a slum, the community leader would ring up the control room of every ward, or he would directly call me or my senior officers, and we would pick that comorbid person who's left out and put them in hospital. So our focus went on surveillance and catching them early. You'll be happy to know that till today morning, 1.72 crore people, 17 million people officially on record have been home visited by BMC. We have been to homes of 17+ million people and checked their health. This is where I always say that unlike the European or the North American model, we decided to forget about the vaccine. We decided to forget about the medication part. We said, let us catch them early, give them oxygen, and make them well. And this strategy really works so well that these days, for the last almost 2 months, the figures in Dharavi, in this 800,000 slum pocket, the figures are never in double digits. They're almost always in single digit every day. So this has been a huge challenge, and equally huge challenge was other slums in Mumbai. So our focus on surveillance, our focus on chasing the virus, our focus on getting after the virus has really paid us very rich dividends. And now people have become so fearless. Our BMC has 100,000 employees, 100,000. And I don't see now fear on anybody's face. They have become so confident that look from where we have come now to what stage. People are freely roaming around in these slum areas. Even whenever I go to any slum, I always decide to do a long march. So my march is never more than 4 to 5 kilometers, always more than 4 to 5 kilometers. I spend at least 1 hour in a slum to reassure people that just by staying on, hanging on there, nothing is going to happen. Whether it was Govendi in M East, whether it is Appapada in P North, whether it is Dharavi, whether it is other slums of Mumbai, we have tried to reassure everybody that if BMC employees, including commissioner, is spending hours in the slums, marching in the slums, nothing is going to happen. The virus is not going to catch us like that, but we will catch the virus. So even these things we put in autopilot now. The surveillance is happening regularly and in a very fearless manner. So the next was the issue of quarantining people, and automatically in chase the virus, we created 48,000 beds by putting beds in various public facilities, as well as requisitioning almost 167 hotels, 2-star, 3-star, 4-star, and we started putting people in institutional quarantine. And finally, treatment. Treatment I've already explained to you. We had so many beds now, the bed allotment, the bed receipt, everything went on autopilot. So this is how we had believed that it's a long-term war. This war is only last for months together. We cannot have a short-term measures of firefighting on a daily basis. Things should be in autopilot. And I can tell you that now, even for a week at a stretch, we don't have to make any intervention anywhere. And 90% of the time, we are now busy in non-COVID activities in BMC. At my level, at the level of my additional commissioners, we are now addressing various issues of non-COVID activities, putting the projects online, opening up the various issues. And all this happened because we could get COVID things on autopilot. Now, coming next to certain other issues, for example, medicine. Now, we decided that we should never fall short of any medicines like remdesivir or tocilizumab or favipiravir or or other antiviral drugs. And I'm happy to say that our state task force has been advising us on drug protocol, and they have been doing a wonderful work. People like respected Dr. Shang Joshi, respected Dr. Oak, Dr. Lahane, sir, they have been guiding us throughout, and we are really benefited out of them. And after issuing the various procurement procedures and making sure that each of these municipal hospitals shall not be without any vital drug even for a day, and we have kept up this promise to our citizens till today. I would say in the last 100 days, there's not a single day then any hospital would complain that this certain medicine was not available. And we went out of the way. We were getting lot of queries from these 100 plus private hospitals. Like I said, we had 147 hospitals on the dashboard. We decided that we would float bids, tenders for procurement of these expensive medicines from these companies like Hetero or Cipla or Roche, and we would declare a contract. And once we order for bulk, the prices came crashing. Like for example, Remdesivir came from 12,000 rupees to 3,100 rupees. Tocilizumab came from 47,000 rupees to 31,000 rupees. Favipiravir came from 103 rupees to 58 rupees. And then we shared the vendor's name and his coordinates with all the private hospitals of Maharashtra and Mumbai. And we shared with all the collectors and all the municipal commission of Maharashtra that if anybody needs these drugs, these are the rates, directly order and get it. So we also ensured that we take care of the availability of medicines in the various private hospitals, not only Mumbai, but all districts and municipal corporations of Mumbai. So that way, it really helped us to fight this battle unitedly. And after this, I must mention that our task force, which has got one of the best doctors in the world, they advise us on drug protocol. They advise us on various other issues concerning COVID. So they have been our friend, philosopher, and guide, in which helping us in a big way. And that is how we are able to devise new models. Now, one more thing which I must share with you, that this has been a very expensive fight for us. Expensive not in terms of money, because BMC is comfortable financially, but in human resource. We, in BMC, we have lost 184 of our colleagues to COVID. And more than 4,200 people have been COVID positive till date. We have to pay a very high price for this. And I always salute my colleagues, and I always pay homage from my heart to all the people who have sacrificed their life. But I said their life should not go unnoticed. The government of India had announced that frontline health workers, doctors, nurses, if in the fight against COVID, if they unfortunately they pass away, they will get an insurance of 50 lakhs. But my employees of BMC, the majority of them were not covered. For example, we have BESC, we have 4,000 buses which are carrying passengers, citizens, doctors, nurses, to and fro. And if, for example, if this driver gets COVID and he dies, he's not eligible for this insurance because in the definition, he is not a frontline worker. So we took a decision on 9th of June with retrospective effect from 1st of March. We said any employee of BMC who unfortunately, if he passes away, starting from 1st of March back date, he'll be given a compensation of 50 lakh rupees by BMC from his own resources. And we also take care of the family. We'll ensure that his next of kin gets a government job, but he must get 50 lakh rupees compensation from us at par with Government of India's insurance cover for frontline workers in hospitals. And we are the only body in the country, whether it's a state government, whether it's in district, whether it is a municipal corporation, we are the only one to have this scheme rolling and functioning today. And because this is our small way of repaying these people back who have laid down their lives for us and for the citizens of Mumbai. So these various issues have been taken care of. And one more thing, when I joined, we found that Mumbai has around 10,000 people who are in permanent dialysis in a population of say about 14, 15, 16 million people. So the moment in March and April, one of these would get COVID positive, so he would be put in one of the hospitals. And you know, in COVID, he's separated from his family, his friends, and he's now away from the world on his bed. And many of the people died because they didn't get their regular dialysis on time, because their facilities for non-COVID dialysis were not there, and they couldn't leave the quarantine or the hospital bed in a COVID section to go for dialysis. So this also, we said that we must have an autopilot system for that. And I must say that we came with one of the best portals in the world, one of its kind, on dialysis. So for this, I'm grateful to Dr. Bichu and his team. We started Project Victory, and which was announced and launched on 21st of May. And this, if somebody is on dialysis for a long time, and how do we take care of him if he becomes COVID positive? How do we ensure that not a single such person dies because of lack of dialysis facilities? So we created a team of doctors and a group under Dr. Bichu, whom also I salute for his wholehearted support and his hard work. And he has done a tremendous job by joining hands with IIT Mumbai and created a CovidRxExchange portal, where the family, once the person is declared positive, he goes to a particular hospital. We have ensured that in all the hospitals, we have put trained technicians trained by Dr. Bichu's team. Secondly, we have ensured that in all the hospitals, the dialysis machines should exist. So we have put in 103 machines in those hospitals where machines were not available. And now, if any person becomes positive and he lands on a COVID bed, he simply has to ring up his family doctor to inform him that he is now COVID positive. He'll open up the dashboard or the online app. He would come to know how many machines, what slots available in that particular hospital on the dialysis machines. He'll block the slot for the patient in consultation with the patient, and he would get a SMS message of his booking. He would share it with the technician there, and the dialysis will happen as per the slot available. And this dialysis facility for a COVID patient who was in dialysis for a long time, it became reality on a phone call in a couple of seconds. And more than 1,200 people this team has treated till now, and they have tried dialysis till now. And there have been 0 deaths in Mumbai since 21st of May because somebody landing up on a COVID bed, not able to get his regular dialysis done, and he died. Not even one case has happened till now. Now, another category of people were there who were on permanent dialysis for months or years together, and suddenly they become unwell. They don't have a COVID report, and they go to hospital to the normal doctor they were visiting. Doctor refuses to attend to them. They say that you are now suspected category. We can't put you on dialysis here. So he could neither go to COVID facility, nor he would go to non-COVID facility. And the poor person had every reason that he would die. So we created 2 centers of suspected categories only through Dr. Bichu's help. One in Ghatkopar, one in Chembur. And now we have put 8 machines there. Anybody who's suspected, he need not go for tests. He need not argue with his doctor in the hospital. He should simply just walk into these 2 hospitals, and doctors in PP kits wait for him for his dialysis. And he's given dialysis there. Even those slots are available online to be booked. And his dialysis is taken care of till his results come. until his status is decided whether he is COVID positive or COVID negative. So this online dialysis portal, it has saved many, many lives. And again, this is an autopilot now. Like I say, everything which we are doing is, we are trying to put things in an autopilot. Now, one more equally important. In COVID, as you know better than me, that dead bodies, once the person passes away, they have to be cremated by the state, by BMC, in our 47 different crematoriums in Mumbai. Initially, there was a clamor, there was a queue of dead bodies coming up there, and patients' relatives would become very unhappy and rightly so annoyed that what is happening. And I would feel pained when honorable ministers, honorable MPs would call me and request me that so-and-so patient is there, dead body is lying in a so-and-so crematorium, and Mr. Chahal, can you help us in cremating a little bit early? I could have never imagined in my life that I'll be getting recommendations from such high dignitaries, respected ministers, respected MPs, that one day they'll be recommending to me that please cremate him a little early. So I said, this cannot continue. Even this has to go to autopilot only. So we created a dashboard again with the help of IIT Mumbai. And now the patient's relatives can book slots. And as per the allotted slot, they can arrive at the crematorium. There's zero wait there, and the cremations happen. This is also a big relief to the relatives who are already under a lot of shock, agony, and pain. This is a small relief we could provide to them by making cremations online. So this is another one example where we try to ensure that day to day we should not get involved in firefighting. Things should happen automatically. Then another very novel or a pioneering initiative we took was, we said that like we need to discipline all the hospitals, not for their billing, but many other reasons. So we decided we were the first city in the country to put young IAS officers in charge of every hospital. Whether it's KM or Singh or Nair or GT or St. George's or peripheral hospitals, we had one IAS officer each. And we gave 7 different duties to these IAS officers. They're young boys working under us. They're still there. And number one, we told them that you immediately start a war room in every hospital. Second, number 2, they should sit in this war room from morning to evening. And they must get every COVID bed, whether ICU bed, whether oxygen bed, whether normal bed, on a CCTV camera. They must do numbering of every bed. Every bed must have a unique ID number. They must ensure that in the municipal and government hospitals, the washrooms are sanitized regularly, and they should be as clean as the washrooms in private sector hospitals. Now, the next function given to them was that they must ensure that the canteens in these private hospitals function, because everybody had fled, and patient relative won't even get a cup of tea in the hospital. So he was a harassed person. So we got in touch with NGOs who flooded our hospital canteens with biscuits and sandwiches. Parley company said, we are ready to give you truckloads of biscuits. Mr. Neswadia told us, he said, you just tell us that this demand, we'll give you the supply, but somebody should be there to handle it. These IAS officers were told to make sure that this canteen start functioning. And I'm happy to share that suddenly there was sea change. And this came as a big respite to the patient's relatives, that they could at least eat there, have some snacks there, have some tea, coffee there, and they need not run around here and there looking for a drink. So then next we told this IAS officers that you must ensure timely updation of every discharge and every admission, because these IT dashboards have no meaning unless they get updated every half an hour, every 1 hour. Only when the doctor sitting on the dashboards can allot a bed to the right person, right bed. Otherwise, somebody will land up in a bed which is already occupied, or we won't come to know how many beds are unoccupied. So these doctors started pushing updation of discharges and updation of admissions. We gave them data entry operators to work 24/7. So I'm happy to say that the young IAS officer did a brilliant job in totally upgrading these hospitals to almost a private sector hospital level. And the moment they came into the picture, all the social media videos disappeared for the last 2 months now. You hardly get a social media video of Mumbai that somebody, two guys lying on one bed, somebody waiting for a bed, somebody lying on the floor. All these, we made these videos disappear through our this system which we created. And plus these IS officers also given the duty that like no private hospital should overcharge the citizen. The 4,000, 7,000, 9,000 per bed. Besides this, there are many incidentals like medicines, PPE kits, gloves, surgical masks, for which patient is also charged. We put 2 municipal auditors in every hospital, major hospital. So now any person before being discharged, his discharge bill was vetted by our municipal auditor, and only then it was announced to the patient. And in many cases, a lot of refunds came to the patients. But I'm happy to say that in 33 major hospitals, except 2 or 3 of them, the remaining 30 hospitals, they had 0 complaint till today of any overcharging. Like hospital like Saifi or Bombay Hospital or Beach Candy, there's not a single complaint till today received by BMC they had to overcharge the patient. And I really salute them for that. The way they have sacrificed their profits. I'm told by them that these hospitals have suffered a loss of 35 to 40 crore each while serving humanity. And that is why I have highest regard for them, the way they have chipped in. And still, last week, we have further extended this arrangement by another 3 months. And they wholeheartedly, they accepted to my request. I think this type of a congenial, coherent relationship, or such a cordial relationship between private hospitals, the biggest ones, and the BMC doesn't exist anywhere else, and in any city of India at least, which is existing in Mumbai. And all thanks to our doctors, friends, and CEOs in this private hospitals and the management and trustees who came to our rescue. So I have given a brief of this. In fact, we announced 24 different models in Mumbai. And we have put all the 24 models on autopilot. And I can tell you that if for a couple of days, I don't even look at my phone, there'll be no problem because there's no message coming to me today from any COVID patient for any help at all, because everything is happening on autopilot. And because of this, Mumbai is so well prepared now to face this virus, to confront this COVID battle one day at a time for maybe months together, even if we have to face that. And as far as Mumbai is concerned, we always say that every patient is precious to us. Every citizen is our respected citizen, and we must ensure that his life is valuable. Initially, we had a high mortality rate of 5% plus. But there also, we have been working very hard. We started a mission, Save Lives, with the help of our respected Dr. Shang Joshi, Dr. Oak, and our other doctor friends. And I'm happy to say that from 5.8, the death rate fell down to 4.8 in July, then 4.0 in August. And in the last 15 days, from 18th of August till 3rd of September, in the 15 days, our death rate has come down to 2.6%. And this also, death rate has happened because I always, I never fail to mention this, because this has always been our one weak point in which sometimes people get a chance to point fingers at us. There's no other place where anybody can point fingers at us. This has happened because we went for a thorough research on the 6th of June. On the 6th of June, I came to my notice, every evening I see mortality figures coming to me. And I asked my team that how in one major hospital of Mumbai, that particular day on 6th of June, how can 17 people die in ICU in one day? Because 17 people deaths were reported in one day. When we went deeper into that, we found that only one person had died in that day, but these reported deaths to our epic cell of BMC of March, April, May also. Suddenly, it struck me that this must be true of hundreds of hospitals in Mumbai, and this cannot continue. We must have these things also on autopilot, and there should be no reporting of death delay beyond 48 hours, because to report a death by any private hospital, a huge file of case papers has to be made and sent to BMC's epidemic cell, and only then we can declare that death. So for example, after that, I issued ultimatum to all hospitals of Mumbai. I said, whatever past baggage you have to declare, you please declare within the next 48 hours. And in future, no death report shall be more than 48 hours old. You'll be surprised that on 11th of June, we had 0 pendency in our epic cell BMC. On 14th June in the evening, we had 862 deaths to be reported. So we dug out deaths which happened at home. We dug out deaths which happened in transit. We dug out old deaths. We did audit of all death certificates issued by ward officers and actual COVID positive people. And then we took out this death. And that is where our death rate jumped from 2% that day to almost 6%. But our Honorable CM, I salute him for his courage. He said, doesn't matter. He said, let us be transparent. Let us not hide anything. And let us not shy away that our figure has become 6% against national figure of 2 or 3% that time. But he said we should show our courage and we should be honest and we should be truthful. And this is what we are till today also. So whatever the figures we are showing today, they are totally in public domain. We are absolutely transparent. But with that also, slowly and steadily, since the denominator was very, very heavy, we are slowly coming down, and our overall death rate also has come down from 5.8 to 5.1 now. I'm sure it will further improve because in the last 15 days, we had a death rate of 2.6% only. And we intend to maintain that under our mission, save human lives. Each life is precious to us. And, but whatever 24 models we have devised, we are absolutely transparent on that. And this is where our team, the BMC's team, I mentioned my additional commissioners, my ward officers, my assistant commissioners, deputy commissioners, we are a solid unit. And everybody is behind each other. And they have done wonders. And equally, the salute goes to the private sector of Mumbai and the government doctors. I must say my deans and doctors of KM, Science, Nair, Seven Hills, they have done a wonderful job. And I really have a lot of respect in regard for them, the way they have risen to the occasion and they have worked tirelessly. People say that the health machinery is now under fatigue. People are fatigued. But when I meet them every morning, they look so fresh. They're so vibrant that even I feel elated when I visit these hospitals and meet these people. So it has been a team effort to the team BMC and the team private sector and the team of government of Maharashtra, under whose direction we work, under whose guidance we work, has done wonders in Mumbai city. And I'm really happy when I look back our journey. Our journey has been brilliant. And just now Dr. Chaurasia mentioned that I have been running marathons. I've been running marathons for the last 18 years now without a break. And I know in marathon, one should never think of the final point. Then you will never run a marathon. If you think that you run so many kilometers, you suddenly get exhausted. You always keep on having targets that I must do half a kilometer in so much time, the next half kilometer in this much time. And ultimately, every time we have reached the end point in flying colors. Similarly, in COVID fight also, I'm sure that once we target one battle at a time, there is no option but victory will be ours. And one thing I always mention, I must repeat here also. In fact, Honorable CM sir has been a pillar of strength for us. Honorable Aditya Thackeray sir, he designed this NSA dome, which is one of its kind in the country, jumbo facilities. It is worth seeing. And the report, it's like a 5-star facility with container ICUs. In container ICUs, only one facility in the country with container ICU, only one facility in the country with a large screen size TVs for patients, with yoga facilities, with dance classes, with meditation classes, counseling classes, everything built in there. It is worth to see the functioning of NSA Dome. And last but not the least, Honorable CM told me when I took over as MCGM Commissioner, he said, Chahal, this is a great challenge. And this challenge comes once in 100 years. He said, if you succeed, success will be yours. But if you fail, failure will be mine. Look at the CM's words. Otherwise, politicians normally say, if you fail, you fail. If I succeed, I succeed. But it's otherwise here. He said, if you succeed, it will be your success. And if you fail, the whole world will say, the Honorable CM has failed. So that one statement really galvanized me. And I decided to put my life, my heart and soul into this. So this is where we are today. Thank you very much.
Thank you. Shashank.
That was a very nice talk and very inspirational talk, Mr. Chahal. I think it's a model which I think should be replicated all over the India and probably for the world as well. I congratulate you for that and thank you for leading us.
Thank you.
Mr. Chahal, it is so inspiring and it is so impressive to see the kind of innovations you brought here, the kind of vision you had, and the way you executed the model. Your fundamental connect, some of the things which are so impressive that your walk, right? That you're walking walking the talk is what I would rather like to say. But when you are going in Dharavi, you are walking 4 miles. You want to see what is happening there on the ground. I believe that is such a fundamental thing. When someone is so fearless, when someone is so dedicated, when someone is so passionate, that is where we gather these things, and we have a learning from you to do. It's not just city of Mumbai, but the entire set of people. They have a great amount of learning to do here. So I think your vision, your capabilities and your innovation, those have galvanized and brought a significant success to Mumbai. I have 3 questions which I will ask eventually, but I will turn over to Dr. Chaurasia and he can continue further.
Thank you very much, sir. Thank you very much for elaborately describing all the challenges and which led to the success in Mumbai in controlling the pandemic. One more thing I would like to mention, which Dr. Gautam has said in a TV show also, when you all sat together for a meeting with the private hospital, where Honorable CM said, in private hospital, he did not want to do charity. He wanted them to sacrifice. And whatever you have said, it's a really great thing that he said that failure would be his, while the success would be yours. And you have really kept the promise. And we would like to have 1 or 2 sentences from Dr. Bharmal when he saw the first patient in Mumbai. How was it done?
Hello, good evening.
Good evening, Dr. Bharmal. How are you?
I'm fine. The most inspiring and the dynamic leadership of our commissioner, sir. He actually gave the picture from A to Z what we have done in Mumbai under his leadership. There are multiple things he has, multiple models he has implemented in Mumbai Corporation, and then it really gave a very nice picture what we are seeing today. In the initial part, during a period of April or first week of May, before he joined, there was a lot of turbulent conditions prevailing in Mumbai, and then the picture was very hazy. Whether what type of things we are going to do in the future and all, what will happen, because we are seeing all the different pictures from all over the world. The things were going in a very difficult manner. And suddenly after he joined our place, there were many problems actually before. There was the attendance problem was there. The attendance problem has improved from 35% to 85% because of different modalities he practiced for so that our multi-purpose worker, laborers, and doctors will be able to attend our hospital premises and do something good for the patient. So that was the first thing that he has done in the when he joined in Mumbai Corporation. During that period, the mortality was very high. It was in always running in double figures. 25 to 30% mortality was there in KM, Nair, and Sion and other hospitals. And that, but after joining, he introduced so many different methods which drastically reduced the mortality to one figure in the month of July and August. He also made us available a lot of drugs actually, which are very expensive. The use of these expensive drugs like tocilizumab, itolizumab, remdesivir, etc., has shown very good results, and we are seeing that the death rate has drastically come down, as he has emphasized in his talk. The CCTVs were installed, as you said, that the CCTVs were installed in nursing stations, then in the wards and in the lobbies, so that we can monitor the type of work that is going on in the ward, the type of exercises that has been given to the patient. Different gadgets were actually supplied during his tenure, and that really helped, like high flow nasal oxygen cannulas, then ventilators. We got a lot of ventilators, and we could start a lot of ventilator beds in our hospital premises. Like in Nair, we had only some 26 beds were there actually. The medical intensive care unit beds were there, but then we suddenly increased it to 110 because it was required during that period, and that really helped a lot of serious patients, and we could save a lot of serious patients. Another very important milestone that we achieved during his tenure in Nair Hospital is that we delivered around 602 babies till today. 602 COVID positive mothers were delivered, including twins, triplets, and like that. So this type of deliveries were conducted without any death, and all the babies, most of the babies they were delivered were healthy, and very few of them got the infection actually. But then surprisingly, within a period of 10 days or so, they again became negative. That was very surprising, and a lot of studies were going on this particular aspect. We have actually made a very good data management also, and our papers are getting published in international journal. Today only we have published one paper from Nair Hospital in Japi. Another surprising thing that happened, that we started with only 43 beds on 22nd of March in Nair Hospital, which went on to build around 1043 beds within a month after he joined our Mumbai Corporation. The current, now that we are entering into a different phase and trying to cover non-COVID and the COVID patients also. So most of the hospitals now entering into the phase of de-COVIDization also, and we are trying to give justice to the patients like dengue, malaria, because malaria is rising, and we are trying to deliver a lot of good things for those patients also as under his leadership. We have also started different projects like giving convalescent plasma and all. Two types of trials have been started. One trial has been conducted by ICMR, and the other trial is been conducted by the Maharashtra government, that is called as a Platina trial. In ICMR trial, we have given convalescent plasma to more than 50 patients, and it has shown quite a good result. Around 80 to 85% of the patients recovered very well. The kangaroo mother care was also been introduced, and 602 children were given, neonates were given this kangaroo mother care. In the initial period, there was a problem with the oxygen beds and all. Our state task force has suggested that a lot of beds should be made available with the oxygens, and then that has been undertaken very on a war footing under the Commissioner Sir tenure, and a lot of beds were converted into oxygen beds, and that really saved a lot of lives. The hypoxic patients were also been treated in a very larger scale, and that in turn led to reducing the morbidity and mortality in our premises. The war room concept that has been introduced into the medical college premises, it is not, even now it is serving a dual purpose. One thing is that we are our doctors are talking with our patients who have been discharged, and we are trying to understanding their conditions at present. Whatever if they have facing any problem, they are called to the hospital with the help of the ambulances that has been, as sir said, that a lot of ambulances are available. Those ambulances are used to pick up those patients and bring back to the hospital and take the care. The other thing is that we are also trying to give the psychotherapy to the recovered patients also, recovered patients, so that there will not be any problem, because the corona is causing a lot of psychological problems also. So that is also dealt by our psychiatry department from the war room. The third thing of the war room that is important is we are trying to convince the recovered patients to donate plasma, so that plasma therapy can be given on a larger scale. That is the Platina trial motto, to collect large amount of plasma and treat the patient with the plasma. So that is also on the way. So the large number of activities are undergoing under the leadership of our Honorable Commissioner. He really galvanized the thing, and I think the results of this galvanization are visible enough. Whatever dream he has shown us and he has seen, is we are trying to fulfill that dream. Thank you.
In fact, I must add 2 points here. That number one, like Dr. Bharmal mentioned about ICU beds. In May, we had 371 ICU beds, and ultimately their figure reached 1,850 within a short span. It was 600% jump in number of ICU beds available. And now, like I mentioned, that during a peak period of June, we had 147 hospitals as COVID hospitals which were taken over for COVID facilities. And recently, about 15 days back, we have denotified 96 hospitals and made them non-COVID. So today on our dashboard of BMC, instead of 147, only 51 hospitals remain by one, which means that 96 hospitals have been now daily functioning as non-COVID hospitals. This is a huge change in the city of Mumbai, where we are now in a position where we can sacrifice 100 hospitals and tell them, don't bother about COVID activity at all, and you are absolutely COVID free as far as your services are concerned. Today we have 51 hospitals against 147 hospitals which we had for our dashboard allotments. And with 51 hospitals also, we have more than 7,000 oxygen beds with us.
Thank you, sir, for this mission marathon information for the control of corona. Thank you, Dr. Varmal, for the information.
Now,
one minute, sir. And sir, I would like to also add that I got the information that under your spiritual leadership also, like Dr. Suresh Kakani, Mr. Subhash Dharavi, they were also having sessions with municipal employees so that their morale were upkept.
Absolutely.
That was also great. So before I go to Shashank, I would also, request Dr. Gautam Bansali to give his input.
Yeah. Honorable, respected Mr. Commissioner Sir, Bharmal Sir, and all dignitaries, I think main points are already covered by Mr. Commissioner Sir. 1 or 2 points I would like to highlight here, since I am a chief coordinator for all private hospital in Mumbai. So I still remember that day one when Sir joined the office, and next day early morning 9 o'clock, Sir called me And that time I was in bathroom and my son Aram picked up the call and he said, Papa, Chahal saab ka phone hai. I said, what happened? Then I talked to sir. Sir said, Gautam, where are you? I said, sir, I'm in house and I'm ready for the hospital. Bola, no, come to my office. We will go to Nair hospital. We will go to ICU. We will wear the PP kit. I want to talk to the doctor. I want to talk to the nurses. I want to talk to the ward boy, sweeper, each and every staff. And I want to see what problem they are facing. And then I want to go to the Dharavi and Govandi, and we would like to see. And then I want to go Sion hospital also to see the mortuary, how dead bodies are they are keeping, and all the things are there. So that way, then I reached the sir office and we went to Nair hospital. He is the first commissioner, I must say, that he wore the PP kit. He went with me in the ICU. He talked to all the staff, nurses, just to boost up their morale. And he gave his personal mobile number to all the staff, even ward boys. You keep my cell number. If any problem like traveling, like food, any kind of problem if you are facing, then just give me a call or just WhatsApp me on my personal number. That is what sir was telling to all the people. That kind of leadership he was showing. He said, I am the person who want to work in the field. I want to give confidence to the people of Mumbai that no need to worry. I am there with you and I want to work and I will work for you. That kind of leadership I have seen in the sir. Second thing, when there was lot of panic in the media, there was no bed in the hospital, private hospital refusing the bed, and that patients are dying on the road. That time sir called me that we will have a meeting with all the CEOs of the hospital. And I still remember that we had a meeting with Mr. Commissioner sir and Honorable CM sir. And in that meeting, CM sir gave us only one dialogue. I still remember the dialogue, and I keep saying this dialogue, that we don't want charity at this time. We want some sacrifice. मेरा गरीब मरीज मर रहा है, सड़क पे जा रहा है, उसको बेड चाहिए, हमको बेड दो. Then all private hospital in Mumbai, I can tell you, all private hospital CEOs said, sir, whatever rate you want to keep, whatever rate capping you want to do, we all want to work with the government. We join hands with you. Such a nice stewardship I have seen in that time, that all private hospitals said, whatever commissioner sir said, whatever rate he wants to put, whatever auditor he wants to put, we are ready. We will work together. I can tell you that time, all private hospital Mumbai were having 700 beds and only 74 ICU beds were there. After that, in that meeting, in next 5 to 7 days, within a week only, we started 2,600 ward bed with oxygen and 590 ICU bed with more than 400 ventilator also. So that kind of things will happen. After that, sir called, we had a one marathon meeting with sir for the bed allotment, because in spite of that all efforts, there were things that whenever we call in any private hospital or big hospital, then the hospital was saying, no bed, we have already allotted to one patient. There was a walk-in patient. That all story was going on. Me, sir, our disaster management chief, Mr. Narvekar, additional commissioner, Mr. Suresh Kakani, sir, we were all in the one room and we were discussing how to stop that and what to do. Then sir gave us a new idea. No, we will start ward war room. Everybody was opposing. Sir, ward war room is a very tough thing. It's not possible in city like Mumbai. एक disaster management, एक जगह पे हम लोग 1916 number रखते हैं. We will allot bed that way only. Sir said no. We will start that ward war room, and from ward war room only, patient will get the report. Patient will get news कि उसको positive है या negative है. Ward war room से doctor patient का history लेगा. उसके घर पे ambulance जाएगा. Patient को bed allotment भी ward war room से होगा. No private hospital or any other hospital will directly allot the bed. We were still opposing, sir, this is not possible in a city like Mumbai, because यहाँ पे काफी VIP patient है, काफी minister pressure है, lot of things are there, and that is not possible कि we will tell them कि no ward war room में phone को, then we will give bed. बोलो no, you still give them bed, but you inform, or your nodal officers should inform to ward. Whatever VIP, VVIP come, they all should come to the ward war room. I want कि not a single bed should be occupied, or not a single bed should be like vacant, and we will say कि asymptomatic patient आ गया या walk-in patient आ गया. I can tell you, Mumbai is the first city where we had this model like ward war room and all. And ward war room, I personally spoke to all the doctors in the ward war room. They were tirelessly working. They are 30 or 40 medical students. They take history from the patient. They go to their house with the ambulance, sanitize their house, they see that if patients are more than 50 or 60 with the comorbidity, they try to get bed, and after that only, bed allocation is totally smooth in Mumbai. I can assure you at this time also, if you call in your ward war room or ward war room call you by morning 12 o'clock, between 8 to 12 o'clock, all patients get bed in Mumbai. This is the only city. There are 2-3 things which is very unique about Mumbai. Mumbai is the only city where sir develop ward war room, where you get bed through the ward war room. And second thing, Mumbai is the only city in the world where you don't need prescription for your investigation, for your COVID test. Initially, there were a lot of things. If doctor write prescription, doctor has to see the patients, then only they can write prescription, or without prescription, you cannot do the test. Now, sir said, no, I don't. We want to chase the virus. आने दो, पॉजिटिव जितना आएगा चलेगा, हमको प्रॉब्लम नहीं है, हमको पेशेंट ठीक करना, हमारी मोर्टेलिटी कंट्रोल करनी है, हमको मैक्सिमम पेशेंट को पकड़ेंगे, ठीक करेंगे. So that kind of model sir gave us, and I can tell you that with that time, with the ward war room, I called one of my friend who is with IIT, Namaste Health. They have some app, Namaste Health, and with the ward war room, with the Namaste Health, we developed one dashboard, covidbadmumbai.com. That on that dashboard, we display our nodal officer. All private hospitals were having nodal officer. सारे nodal officers का number we display, and with ward war room and nodal officer, they just coordinate each other. They that allot the bed. If suppose some patient come with a breathing difficulty to any hospital, we adopt one policy: no patient refusal policy. Patient comes to you, you treat patient in your triage area. Triage area should be with oxygen facility. We treat patient with in the triage area with the oxygen, and our nodal officer just see on the dashboard covidbadmumbai.com if there is any bed, or then that nodal officer, like in Bombay Hospital, if there is no bed in Bombay Hospital, he will talk to Hinduja or that Bridge Candy Hospital, see on that dashboard, he will talk to that hospital, he will arrange the bed. Patient should not feel कि मुझे इधर भटकना. I can tell you after that only, or when we adopt this system, not a single media report is there. Not a single patient died because of bed is not available. No, आपने इतना time में you will not heard any single news कि मुंबई में patient को bed नहीं मिला, patient मर गया, ये हो गया. So that kind of leadership is there. Still, I can say it's a new learning, new thing for everybody, and there is always there new guideline. In last 4 or 5 months, more than 42,000 patients. More than 42,000 patients are treated by the private hospital, and rest all the things are there. That all core team is there. It's a totally teamwork. All healthcare worker like ward boy, mama, mosi, sweeper, khana pahunchane wala, doctor, nurses, resident doctors, nurses. They are the backbone of the hospital. All work so tirelessly because हमारा सेनापति is very strong, Raja is very strong. ये लोग strong तो सब लोग काम करते हैं. That's why. And because of that, Mr. Commissioner says things, all get good confidence that no, we should work. No fatigue, no tired, nothing is there. Senapati is there, we have to work, and we are working. Thanks a lot.
Truly awesome. I'll tell you, this is so, you know, the only adjectives are coming to my mind, whether it be visionary, whether it be profuse, whether it be organic, whether it be innovative, exemplary, original, authentic, transparent. You talk about it, you talk about a parameter, and you know, what we see here is a very comprehensive plan was done. And you know, I see administrators of two categories. One is basically those who work from the boardroom, and there is another category like Mr. Chahal, who work on the ground. You know, when you told me the story that, you know, he called you on the table, right? What he told you, right? You know, he went to the hospitals, ICUs, the mortuaries, you know, Dharavi, everywhere. See, there are different people. Like when you bring that connect, that is basically where, you know, you can bring innovation. And so impressive, very, very impressed about this. I will let Ajay talk, but I have 3 questions which I'm going to ask eventually. Ajay,
you can continue. You can continue with the questions, please.
Yeah, please come forward. The questions. Welcome.
Okay. So I am so much impressed by bringing automation or autopiloting, or basically what you typically call it as autopilot, right? We call it as basically mechanization or automation there, right? that was very seamlessly affected there. What it means is basically having a very good process modeling. That's number one. Having a good decision nodes, number two. Having a criteria as to which decision node to undertake at what point of time. And then, having a very good handshake as well as having a good RACI, what is typically called as responsibility, accountability, communication, and informed. That kind of, those are the components which make autopilot a great success. Can you highlight us how you define this? Because there is within the audience, there are so many people from different cities who are learning something here, who are seeing the onslaught of COVID, and we really want to know that. So that's my first question. Kindly help us understand.
Yeah, when I took over, I knew that we are fighting an invisible enemy, and we do not know how long this fight or this war is going to go on. I give you an example. We have one patient in Mumbai, which was reported in today's Mumbai Mirror. A cancer patient with blood cancer became COVID positive on 26th of May, exactly 100 days ago. In the last 100 days, he has been tested 15 times, 15, and still is positive. 100 days, he's not becoming negative. Now, this is a very unique case where a person almost 26th May, and today it will be like 97, 98 days, maybe 100 days. Just 15 times we have tested him continuously, and he's with us in the hospital. But still he's not turning positive. But we are taking care of him. We have ensured that he's surviving. So this is one example that this is such a strange virus. Nobody can predict its behavior. To one person, it is asymptomatic positive. The symptomatic positive transfers to somebody else who becomes symptomatic and dies. It is so strange and so unfortunate. So I knew that when I was talking to experts, I knew this is going to be a battle which may go on 1 year. It may go on for 2 years also. That time I never knew when vaccine will come or not. So we decided that we must have now permanent mechanisms. Otherwise, it will be impossible to control mortality, and it will be impossible to ensure that nobody dies on the road, nobody dies at home, nobody dies without treatment. So this is where every particular component in this, every particular item in this, or a content in this, or an activity in this must be on autopilot. Only then you can face this onslaught. Otherwise, one day it would have taken you over.
Okay. Yeah, I think that is an important thing for all of us to learn. What are the handshakes? Where are the handshakes happening? It's not just there are multiple streams. Say, for example, the administrative, the hospital stream, and integrating the multiple streams is one of the big challenge. The way you have surmounted it is just phenomenal. That's how I would say. And it talks about your vision. It talks about your ability to connect with the people and get them onboarded. Oftentimes, it is not possible to communicate that passion. You injected people with your passion, and that's basically made the difference here. Just hats off to you. You want to add something, sir?
Yeah, I was saying that Mumbai is a very enlightened city of the country. It's a great city. The stakeholders are many. You have citizens who are very well aware of their rights and duties, and they're very well read. You have media, one of the most powerful media in the country, in electronic print media. You have doctors who are one of the best in the world in their own sphere. You have other people like your government sector doctors, your people in the administration. It is really, really very important that all they work in a combined fashion. And it is really a challenge to get them on board. Because, people, especially many of the stakeholders, they have very little patience. They run out of patience very fast. And you know how media is, and how and then we have our political representatives. When the opposition party is rightly so in democracy, even they are a great stakeholders. To get everybody on the board is a humongous exercise, and this can happen only if your actions speak, not the words. And once your actions speak, then everybody starts coming on the platform.
Yeah, absolutely.
So I would like to add one thing, Dr. Shashank. Like once he took the post of municipal commissioner, he came out of the Zoom.
Yeah.
He came to the ground. He came to the road. When people saw the boss himself works on the ground tirelessly, सब दौड़ने लगे.
Yes.
You can also say, मतलब चहल साहब तो अकेले ही चले थे जानी पे मंजिल. लोग मिलते गए, कारवा बनता गया और कोरोना मरता गया. Because he came down to the road. Believe me. Otherwise, because the fear was so much. The fear was so much. And he did fearlessly. You can ask your last question.
Absolutely. Yeah. So I see that, you know, and just to re-emphasize the same point once again, that when the leadership actually, you see, leadership can inject their passion only through their actions, not through their words. And this is basically a very classical and unique example here. Let me go to my next question, which is basically on resources. See, I consider resources on two dimensions. One is basically the human dimension, and part of that is basically the healthcare workers. That is a very key thing. And the way you have taken care of even the non-frontline workers, that is amazing. So, you know, I would like to understand how you evolved a seamless model by incorporating and by, you know, embedding so many of that, like expanding your pool of resources. I'm talking about the healthcare resources. That's one. Secondly, I have on the same lines, I have another question, and that is about your material resources, right? It can be PPE, it can be visors, it can be N95. We all went through a supply shock here, right? We all went. How did you achieve that supply optimization, supply chain optimization?
Yeah, the 2 points. The second point first. Fortunately, the Mumbai Municipal Corporation (MCGM) is financially a very stable and a rich body. That really helped me a lot to invest the resources in the right direction. And for example, we decided that I would provide free PPE kits to thousands of doctors in the private sector in the month of May, June, even today also. Who have their clinics or a one shop clinic in containment zones, slums, and they will get their weekly quotas in advance on wardrooms and everything. The BMC will bear the cost. So the reason was we could afford it, unlike many of the other bodies who may or may not be able to afford, at least in our country. That way we were lucky, and we ensured that, like, and when the volumes went huge, our PPE kit tender would be 300,000, 400,000. So the rate came crashing down from 2,000 rupees to PPE kit to 400 rupees now. So this is one. And secondly, as far as our human resources concerned, I knew that in any battle or any war, like my father was an army officer, he says that the morale of the force has to be very high. Even if you have meager resources, the morale of your manpower or your human resource can do wonders. So I knew that, like, people are dying every day if they're not taken care of, or if their families are not taken care, whether he's a sweeper, whether it is a small ward boy. Unless we take care of him, this word is going to spread like wildfire, and everybody will get demoralized. And people start imagining that it happens to him, what will happen to his family? There's nobody to fend for him. So this is where I stepped in the right time. I said, nothing doing. They are our family, and it is our duty to take care of a family, come what may, whether we have to give them 50 lakh rupees compensation, irrespective of whether he's a chief engineer, whether he's a sweeper, everybody gets 50 lakh rupees. And secondly, we have given a word that we shall take care of the families in future also. So this is how once people realize that the commissioner is behind our as a great support, he's like a rock behind us. People started giving their not 100%, they started giving 110%.
Great.
Yeah, that is truly impressive. My third question is on stakeholders. With a diverse population like Mumbai, where the stakeholders are so different, right? I mean, I'm going to talk about the lowest strata first, because that is one which needs immediate attention. Say, for example, the migrant population. How did you manage the migrant population? Then there is basically a category of vulnerable population, which you talked about the dialysis units, right? How you enable dialysis in every hospital. That is so impressive, very, very unique. So I'm kind of trying to understand this vulnerable population. And in addition to that, there are several non-COVID related emergencies, or, not elective. Let me point it out this way: non-elective, non-COVID non-electives, which need attention. How did you manage, or how did you put your hospitals into categorize something like the red zone, amber zone, green zone, something like that? So vulnerability, I mean, the stakeholders, as well as, how you manage that.
Yeah. Number one, we did a couple of things here. First of all, when lockdown was there, the main issue before migrant labor was that they are people who are earning their bread one day at a time. And these people, they earn something, and by evening, they spend it, and then again the next day comes. So we started distributing free food packets to each of these migrant labor. At the peak time, 700,000. 7 lakh people were given food packets by us, morning breakfast, lunch and dinner. And we were spending something like 80 crore rupees every month on giving this free food packets to our citizens. So this was a great relief to them. And whenever I would visit any slum or containment zone, I would ask the community leader there and randomly the slum dwellers that what is the kind of food coming, whether 3 meals are coming in a day or not, whether food is warm, it is fresh. So I am happy to say that 100% I got a positive feedback. There is not even one single case on record where somebody complained that food packet is not coming. And secondly, we announced that when I took over this, and all 100% ICUs in private hospitals, in the major hospitals, that time 417, later on they became 590, like Dr. Gautam just mentioned. We said that if any slum dweller comes and lands up on a COVID bed under government quota on beach candy bed, and the richest citizen of Mumbai in the 20% category, both will go to the same ICU. Because 100% ICU will be control of BMC. They'll be lying in the neighboring beds next to each other, wearing the same uniform of the hospital. They'll be treated by the same doctors, and they'll be given same kind of medicines. And there'll be zero discrimination. And once they get well, the rich man goes to his luxury ward where he's paying a couple of lakhs a day, and my poor man goes to his ward where he's paying 4,000 rupees a day. This equality is unheard of anywhere. Like you have the richest of the rich and the poor of the poor in the same ICU, getting the same treatment from same doctors. When this message spread, there was so much of positive vibes which came in the citizens that this is really like egalitarian thing where people are being treated equally.
Very impressive, very impressive. Ajay, over to you, please. Dr. Bhandari, if you have something to say, please go ahead. Ajay, you are on mute. Dr. Chaurasia, you are on mute. Okay.
If there are any questions from the audience.
Yeah, I believe we have one question from the audience. Give me one moment. Let me quickly look at it. First of all, let me... go ahead, Dr. Himman. Please go ahead. Dr. Bhandari, please go ahead.
Yeah. How do you see the future? And what do you, this model, can it be replicated all over India? Is there your communication with other municipalities and smaller towns?
Yeah, no, in the future, I would say, I must say that in the month of April, May, and June, we were doing about 4,000 tests every day, and we are getting a figure of about 1,400, 1,500, 1,300 per day. Then in the month of July, we went from 4,000 tests to 6,500 tests every day, and the figure fell down to about 900,000, 1,100. Today, we are doing about 8,000 tests a day. Still figures are 1,400, 1,500, 1,600, which means if you compare with June and September, with 4,000 testing, we were getting 1,500 figure. Today, with 8,000 testing, we're getting 1,500 figure only, which means that if we had not increased the testing, our figures would have come down to 600, 700, 800 now. So we are going for a positive change. Secondly, we had a very tough time in the last 4 months. This I just slipped off to mention. Good, you reminded me. You know, we had a very difficult monsoon from June, July, August. We had a threat of a cyclone on 3rd of June, which actually came on 5th of August, with a wind speed of 101 km/h. And Nariman Point was flooded with 4 feet of water, the entire southern Mumbai. And this wind velocity of 101.4 km is unrecorded in the history of Mumbai city. And anything more than 70 km/h is a cyclone. And we were 100 km plus. The boards of Bombay Stock Exchange on 20th floor were blown away. We had Just Lok Hospital windows falling apart. It was a huge havoc. The huge cranes of JNPT falling into the sea, which lifts the container in 2 seconds. So we had a huge, massive this cyclonic winds and a huge thing. For the first time in the history of Mumbai, the southern Mumbai, Malabar Hill, Nariman Point, Churchgate, Baikula, they got flooded by 4 feet water. The Marine Drive had disappeared with huge amount of water. It was part of the sea. Then we had the wettest July in the last 76 years. Now the reports say that we have the wettest August in the last 56 years. And all the experts all over the world told us that this moisture is very conducive to this virus. The moment you have more virus, more rains, we were told in May that these cases will double and triple up. So we have gone through this very difficult phase of June, July, August with continuous rains. And this year the monsoon has been very heavy. And with the cyclonical storms also we faced. And then we had a lot of festivals. We had Bakri where 300,000 slaughters happened. We had Muharram. Now recently we had a 10-11 day long Ganpati festival. And for the first time in hundreds of years, more than 100,000 Ganpati idols were immersed by BMC officials only. No citizen was allowed to go to the sea for immersion. We created artificial ponds. We created mobile ponds. We created in-situ ponds. We created collection centers in various grounds of Mumbai. We had 445 such points where this 100,000 plus idols were collected by us, and 10% immersion was done by us. We had a huge responsibility. And plus, in those 11 days, there was some crowd coming out, maybe meager, less, but festival is festival. Despite all this, still we are in any comfortable situation. That is a great takeaway in the last 4 months. And now, when we look forward, starting in October, we have a lot of October heat in Mumbai. October is like summer in northern India. Even November, December, January, we don't have that type of a cold climate, which northern India may have, which Europe and America have. But we are in half sleeve shirts in December also. So I look forward that our climate will be more positive towards fight against this virus, starting from now onwards till about next May, June. So things are very rosy according to me, and we are looking very, very optimistic, and we are very positive for the future.
Yeah, thank you very much for answering that.
Thank you, sir, for the elaborate information. And we agree with you like Mumbai under your leadership was
One
never
more question was there, that can this model be replicated in other cities and other states of the country?
Yeah.
Now, certainly it can be replicated. There is absolutely no problem, but it involves a lot of coordination. It involves a lot of stakeholders coming together. That itself, and in a human resource for human beings to come together from various sectors, doctors, then administrators, then citizens, then media, then private sector, government sector, politicians, opposition parties, all coming together. Here we have come. So if any other city can surmount all these issues and come together, it is highly replicable model.
Thank you very much. We have already done webinar with Indore city and as well as Coimbatore city. And we hope in the future that other cities also would join in, and hopefully will share the model which you have very nicely produced in Mumbai. Thank you very much, sir.
Thank you very much.
Sir, we agree with you, like the kind of conglomeration you could gather of diverse resources. So it did not convert Mumbai under your leadership into a New York or an Italy or a Brazil-like state. And as you have rightly pointed out, the proportion of testing and almost the static or a receding number of corona patients, we are absolutely hopeful that we are in the safer hands and we are going to eradicate this as early as possible.
In fact, I must mention here one more point, that when I had taken over, there was full of media reports, electronic and print media, that there should be military which should be brought into Mumbai.
Yes.
And the army should take over.
Yes.
Things are going out of control.
Yes.
But I'm happy to say that the same media, in the last 100 days at least, there is absolutely zero adverse news of Mumbai.
And you have killed the fear. You have killed the fear amongst the residents, amongst the citizens. That is a great achievement, sir.
That's correct.
Go ahead, Ajay. Ajay, you want to say?
Any other question? No, I just want if any more participants have any questions. Yeah, please.
So there are questions from the participants, but mostly there is so much of appreciation for your work. There are so many compliments which have come there, and there is what should I say? It's I would call it as ovation. There is no other word to talk about you but ovation. That's basically how people are recognizing. I will send all the compliments to you eventually, sir. But let me go to some 2-3 questions here, and I'm going to read those questions out to you one by one, because I want to do justice to all of the folks who are participating here. The question is, please make a team of dedicated officials whose only job would be to pay random visits to all the centers, because what you envisage may not hold good at the ground zero. They should feed in their reports daily for your team to assess. They could interview anxious relatives and note the practical weak links to be plugged by your able team. So this is the question from one of the audience.
I'll respond to that. I have no doubt that we have a great team. All my additional commissioners, they have been doing an outstanding work. And the entire BMC has been a well-knit unit, and they have performed much beyond my expectations, outstanding. But I always believe that there is always room for improvement. And this is what we always believe. And I'm absolutely sure, I take it 100% that weak links still exist. Like, for example, we need to have more counseling sessions. We need to further increase our surveillance, because this is not end of the matter. This is not end of the war. It's ongoing war. It's called going on, and we have to reassure our citizens that we will perform even better than what we have performed till now, and we will keep on revisiting our shortcomings. We'll keep on revisiting our weaknesses, and every morning we meet and we always discuss that where we can further improve. And the point is well taken, and I accept that we do have weak links, and we will again rise to the occasion those fronts.
Have you kept a portal where people can provide their feeds?
Yeah, that point is noted, and it will be. I'll work on that.
Wonderful. Thank you, sir. Thank you so much. Let me go to the next question. Does Mumbai need restructuring on its healthcare and social support system post-COVID era? What's Mr. Chahal's view on this? I'm reading the question.
Please come again. I didn't hear the question properly.
Okay, I'm going to read the question the way it was shared in the chat. Does Mumbai need restructuring its healthcare and social support system post-COVID era? What is Mr. Chahal's view on this?
I partly agree with that. We need to be continuously reinventing ourselves, and we have to always rise to the occasion. In fact, as an example, I'll give you an example. Honorable CM sir told me about a month back that now we have created 9,000 plus hospital beds, including ICUs, dialysis beds in open playgrounds like BKC, by race course parking. So one day when this epidemic goes away, maybe in next couple of months, or maybe in one or 2 months, what happens to that entire huge inventory? We cannot just throw it away. So immediately we took a decision that let us build one of the largest infectious disease hospital in the world. And we have already decided that at the level of Honorable CM sir, that we will build a 5,000 bed single infectious disease hospital in Mumbai, bordering MMR Thane area and Mumbai city, somewhere in Mulund, Vikhroli area. And we will ensure that accordingly, then we got into action. We issued an expression of interest to select land, at least 20 acres of land, to build this infectious hospital. Last week, the bids have reached us. We are scrutinizing those bids, and then we have told our architect, Mr. Hafiz contractor, that he should design a 5,000 bed hospital, which normally would work as an international exhibition center with hotels and things like that, in close proximity to the railway stations and the major road. And in times of emergency, it can be converted into an infectious disease hospital in a few days' time with inbuilt structure like that. And maybe in a month's time, we will start working on that. And we have resolved that Mumbai needs a world-class, one of the biggest in the world, 5,000 bed infectious disease hospital, which will be coming up now.
That is very unique and impressive, because you have envisioned a future need for infectious disease to emerge something likewise, right? And I think building, having from this experience, the way you are carving out the future is really, really impressive. One last question, which is here, and that is from Dr. Ashish Tatav, who is a dedicated doctor working in the Melghat tribal area. His question, I'm going to read it the way it is. Can robots be used for treatment like endotracheal intubation and ventilator management? Can teleauscultation can be used to prevent infection of treating doctors?
Absolutely, yes. Telemedicine is a very promising field. Even now, in Mumbai, we have a task force of doctors under Dr. Oak. We have Dr. Udwadia, Dr. Shank Joshi, and many other doctors, Dr. Dalil Parker from Lilavati. They are members of the task force. And we have been telling all the collectors of Maharashtra all over the state that if any hospital in the rural areas, in a small district, if they need any advice, they should resort to the telemedicine and teleconference. And we actually are doing it, but it needs to be further promoted.
Okay. One last question here is basically on open areas. What are the open areas or challenging areas? One of them you already talked about, that you're going to open a feedback system there where the users or the citizens can directly give the feeds. But what are the other open areas which you see here?
I always say that to win the confidence of our eminent citizens, things have to be absolutely transparent. The more transparency we have, the more trust we can command. And so basically my principle is that any action we take, whether it is COVID action or non-COVID action, our transparency should not be felt, it should be seen also. This is how I reply to this question, that every sphere, whatever we are trying to do, for example, we are, as a municipal commissioner, I have to give a lot of permissions for new real estate projects, buildings, the towers which come up in Mumbai, 60 story, 70 story, and things like that. So we have started a system that everything is online, and there will be no interaction or no face-to-face meeting between the officials and the promoters. And we are trying to maintain that every Friday we have zero online clearance dependency with us. We are maintaining it for the last several weeks now. So the real estate industry, the Maharashtra Chamber of Housing Industry, the CREDAI, they have greatly welcomed this transparency and this proactive step on our part. This is one example. Whichever field we come to, we would like to be very transparent for people to see us and judge us.
Another question for Dr. Bharmal and Dr. Gautam Bhansali. Are your SOPs online, and can they be utilized by other municipalities, corporations, or smaller cities? Can they refer those?
Yeah. Go. Gautam must speak.
Yeah. Sir, we have a lot of SOPs like for that opening of the operation theaters, like initially for the elective surgeries, emergency surgeries, now is elective surgery. Now for all kind of surgeries, we have the clear-cut SOPs for different departments, like for orthopedic, for neurosurgery, for cardiac surgeries. We have full setup of the SOPs, which is made by the renowned doctor and the concerned doctor and the department people, by the nurses, by the doctor, and all the things. And our all SOPs are already online. We are already distributing to the other hospital, periphery hospital, municipal hospital, and other places also. So SOPs are there for the online consulting. SOPs are there for the OPD practice also, OPD clinics. So in Mumbai, all hospitals are open for not only for COVID, for non-COVID also. In Mumbai, all consulting are also open, and all operation theaters are open for elective and emergency surgery for both.
The other SOP is regarding the tocilizumab, then atolizumab, then the other drugs is already on the this thing. It's already been displayed by the task force of Maharashtra, and they are available for use of anybody actually who are eligible to use it. The plasma therapy also, the guidelines have been decided by the Maharashtra government. The Platina trial guidelines are there. So that also can be used by the other beneficiaries with the limitations and the rules and regulation protocol devised by the Platina trial of Maharashtra government. So all the protocols are there on the online. They can be used by the eligible people.
Thank you.
Thank you.
Dr. Chaurasia, Dr. Bhandari, if you have any questions, or I would like to thank Mr. Chahal for such an awesome thing here. But please go ahead with your questions, and then finally we can go to the conclusion.
I think it has been very nicely and elaborately done, and it is in itself an encyclopedia or a guide for various cities, corporation, districts here and across the world. And we really appreciate Chahal sir's philosophy of what we call Vasudhaiva Kutumbakam. The world is my family. And that has really made real changes, because on ground he did everything. So this is a model like we are already in interaction with that Coimbatore Corporation. So it will be an extremely, helpful for them. And we are grateful to sir spending so much. Sir, how much you work? This is how did you gather this kind of energy and getting people, resources, everything? And now you gave us 2.5 hours. That is incredible, unbelievable. So thank you very much. And we are extremely grateful to that. And this is an organization which is helping people in the remotest of area where they can, visit the website. This will also go on website and they can, treat patients and, it is very helpful to them where I am telling you, we are done in Mumbai. We are done in 3-4 months. Everything we know, everything by and large about Corona, and everything keeps coming every day. Like for the physiology, pathophysiology, there is one more concept which has come now. Like it was a cytokine storm. Now it is a bradykinin storm. So Corona will keep posing new and new challenges. But I am extremely, happy and grateful for Chahal sir. He has been asked to look after, to guide Nagpur people also. And sir, you will have to do this to various places because we ourselves, I myself am realizing when I'm from Amravati, I have been speaking to patients at Nagpur, Amravati. They are yet to, get exposed to this kind of working which we have done. Definitely in a month's time, 2 months' time, they will also be completely trained. But this needs to go down the district level, taluka level, and we have to develop this kind of thing because pandemic is not in Mumbai. Pandemic is global. And in India also, as we see, when the Mumbai, this is receded, but cases have started spiking, rural areas and all. We are really grateful to you, Dr. Gautam Bansali, for sparing this much of time, Dr. Bharmal, and all our participants. And we are, I would say we have a regret that most of the people could not join that because of some confusion in the ID. I believe, but there is no need to, feel bad about it because this is a recorded session and this will go to every nook and corner where it is of help and it will assist in managing Corona at large. This is one disease which is not which cannot be managed medically in the hospital only. This needs a lot of logistics, infrastructure, community management, and last comes the hospital. If you make these arrangements, then you can treat them. And you have done this wonderfully, sir, because we have, when we started and where we are now, it is explicit and it speaks itself. Thank you very much, sir. Thank you very much.
Thank you very much.
Please express your gratitude.
Thank you.
Thank you very much. Hemant, you want to take over or can I conclude the session?
Yeah, I also would like to thank Mr. Chahal and all the panelists for contributing. I think session probably we have taken quite a lot of his time.
I'll just conclude in a minute or so. Mr. Chahal, we are so thankful to you that your work is reflected in whatever you have done here. There are less questions and more ovations, more compliments, more appreciation. If you see what I'm receiving here in the chat messages, you will be amazed. I'll tell you, it would have really made headlines. It would have made, this is amazing. We are so thankful to you. And we invite you to be a global advisor for other cities, not just India. But, your model can be extrapolated so many places. Thank you again. Thank you.
Thank you very much, sir. Thank you very much.
Thank you very much. And all the best to all of you. Thank you.
Thank you, sir. Thank you.
Thank you. Thank you. Thank you. Thank you.
Thank you.